Hello, my name is James Trajari, and I'm the Executive Director at Legal Assistance for Seniors. It is my honor to welcome you to today's program, The Aging Landscape in California, an overview of the 2020 budget, legislation, COVID policy response, and the Master Plan on Aging, presented by Claire Ramsey and Kevin Prindiville from Justice and Aging. This is the second in our series of 4 webinars addressing various topics on elder abuse. As you all probably know, when we hold the conference in person, it takes many dedicated people and agencies coming together to produce such a large function. And this webinar series is no different. First, I would like to thank all of our sponsors who continue to support us through this transition to online education. Their continued dedication and excitement for the work we do is amazing. In particular, I'd like to thank our 4 top sponsors. Michael Stevens, Probate and Trust Realtor, our diamond sponsor. Campbell Green, our platinum sponsor. And our 2 gold sponsors, the Tile Shop and Acuna Wrigley. Michael Stevens has been an incredible support to LAS and is always there to help with enthusiasm. If it involves supporting older adults, Michael is always there with a big yes, and how can I help? Campbell Green has been with LAS long before I came on board. For anything big or small, Philip Campbell is always helping LAS, from emceeing events to guiding the agency by volunteering to be board president. Phil believes in older adults and in LAS. The Tile Shop and Acuna Wrigley, our gold sponsors, have been supporting LAS's work around preventing elder abuse for many years. They are always there to support this work, and we really are so appreciative that they continue to believe in the importance and value of preventing and stopping elder abuse. We have a whole host of sponsors at the silver and bronze levels that we are so incredibly grateful for. Many of these sponsors have been supporting this work for many years. They are our collaborators and our partners, and they keep us excited to continue to do this work. At the silver level, we have Anderson, Yazdi, Wang, Minton, and Horn, Fiduciary Accounting Services, IMT Associates, and Mechanics Bank. At the bronze level, we have 21st Century Care Solutions, ARM Homes, Center for Elders Independence, Evans Law Firm, Farmers Insurance, Golden Gate Fiduciary Services, John Balquist Fiduciary Services, the Law Offices of Sonoy Rousseau, Merlander Company, the Professional Fiduciary Association of California, and Alameda County Supervisor Wilma Chan. In addition, Golden Gate University was going to host the conference in May, and while that did not happen for obvious reasons, they have continued to support LAS in this webinar series with technical support and serving as the honorary event host. The Institute on Aging and their amazing staff continue to be wonderful partners in providing continuing education units for a wide variety of professionals. Last but not least is the team that contributed their time and hard work over the past several months to transition an in-person conference to an online experience. Greg Bedard, Katie Brady, the entire LAS staff, and our event producer, Becca Bloom from BB Events, and Gracie Quinn from Golden Gate University. As I'm sure you're aware, today's presentation is part of a series of 4 webinars LAS is producing in the coming weeks. They are all free of charge and open to the public, though a donation of $25 per webinar will be greatly appreciated and accepted in order to support our ongoing work. We hope you find these presentations informative and useful. You can register for these webinars by visiting our website at lashighcap.org. That's LASHICAP.org, and going to events. Thank you again for joining us, and I hope you enjoy the program.
Good afternoon. My name is Jenny Pardini, and I am the Community Education Advocate with Legal Assistance for Seniors. I'm delighted to be your moderator. Today, you will hear a 45-minute educational presentation from our guest speakers, followed by a Q&A that I will be moderating. If you have any questions for our speakers, please submit them at any point during the program by clicking on the Q&A icon at the bottom of the meeting screen. If you have any technical issues, you can ask us in the chat, and our technical team will do their best to assist you. All right, let's get to it. It is my pleasure to introduce you to Claire Ramsey and Kevin Prindiville from Justice and Aging to share their knowledge on the policies around justice in the aging community. Claire is a senior staff attorney at Justice in Aging, focusing on California healthcare issues, including Medi-Cal and in-home support services. Claire formerly worked as a staff attorney at the Legal Aid Society of San Mateo County, where she represented seniors on issues involving healthcare, public benefits, and elder abuse. She received her law degree from UC Hastings College of the Law in 2006 with a concentration on public interest law. Kevin is Justice in Aging's executive director. He is a nationally recognized expert on Medicare and Medicaid policy and has served as counsel in several class action lawsuits protecting low-income seniors' access to public benefits. The author of numerous articles, reports, and briefs, he frequently testifies before legislators, presents at national conferences, and works closely with both federal and state regulatory agencies. Mr. Prindiville is a member of California's Master Plan on Aging's Stakeholder Advisory Committee. Welcome to the program, Claire and Kevin.
Well, thank you for that introduction. We're really thrilled to be here with you today. Legal Assistance for Seniors is such a valuable partner, does such incredible work, and this conference provides such a great opportunity for our community to come together, to share information, to learn a lot. So we at Justice in Aging are just really grateful to be a part of this. Today, my colleague Claire and I are going to be giving you a policy update, particular to California, but also touching on some federal issues, looking at what has been a very eventful year on the policy landscape, especially the last 6 or 7 months. We're going to be covering the California budget cycle, this last cycle, the legislative cycle related to the budget and otherwise. We're going to look at what's been happening at the federal level with legislation and policy, and then also touching on California's Master Plan for Aging. So a lot to cover today. I do want to say we're recording on September 2nd, and in policy, especially these days, things can change rapidly. So to the extent that there's updates, we'll be providing some of that during the Q&A session of the presentation today. So with that, I'm going to pull up my slides here. So like I said, we're going to be covering California's aging landscape, looking at what's been happening on the policy front. If you're not familiar with Justice in Aging, we're a national organization that uses the power of law to fight senior poverty. We focus on helping low-income older adults secure access to healthcare, economic security. We also work on issues around elder abuse, housing, and we also work on court access issues for older adults. Our work is primarily centered on advancing equity for women, people of color, LGBTQ individuals, and people with limited English proficiency. We've been around a long time. We are a national organization, but we have a particular focus in California where we have 2 offices in Oakland and Los Angeles. We're going to be sharing a lot of information today, and like I said, a lot changes in the policy arena, and we have a network that we run, and you can sign up to be a part of that network by going to our website, where you can also, right now, you can get signed up by texting the message "for justice" to the number 51555. Once you're in our network, if you're not already, you'll get lots of email updates, giving you updates on new policy developments, tools for how to assist clients with various legal issues, action alerts, ways that you can participate in advocacy to improve policies for the clients that we collectively serve. We start every one of our presentations that we do at Justice in Aging kind of going deeper in what we mean by some of the equity work we do. And at Justice in Aging, we feel that it's really critical that in engaging in this work, that we acknowledge systemic racism and discrimination, that we need to work to address the enduring negative effects of racism and differential treatment that compounds for people throughout their entire life and affects what their experience of aging looks like. We work, we think it's essential to promote access and equity in economic security, healthcare, and the courts. We also at Justice in Aging work very actively to recruit, support, and retain a diverse staff, a diverse board, including race, ethnicity, gender identity and presentation, sexual orientation, disability, age, and economic class. And we think that these are fundamental things to acknowledge in our broader work for social justice, and racial justice. Our agenda for today, Claire is going to get us started with an overview of the California budget. She's going to be covering issues that happen in the budget related to healthcare and long-term services and supports, and also other aging programs. Then I'm going to give an update on what's been happening at the federal level, and then with California's master plan for aging. And then we'll be transitioning to a Q&A session where we'll look forward to discussing this with all of you. I'm going to hand it over to Claire to get us started on the California budget.
Thanks, Kevin. We're going to go now into California's budget and really talk about what happened and what we're going to be seeing in this 2021 budget cycle. All right, we're going to start by talking about the health and LTSS programs in California. So one thing I'm going to walk through as I go through each slide is that California has a somewhat complicated budget process. There is a governor's proposal in January, and then typically there is a lot of legislative action in the spring months where they examine all the governor's proposal and put forward proposals of their own. And then in May, the governor releases a revision of his budget, and then the legislature and the governor go to negotiations. And then by June 15th, there is a passed budget, which the governor generally is prepared to sign. This year was quite a bit different because the governor did release his January budget, but because of the pandemic, the legislature basically did not hold any of its normal hearings. So what that meant is there was sort of no time to discuss what the governor had proposed in January, which were largely positive and forward-looking changes to programs, expanded programs, increased revenue, and increased spending. After the pandemic, and there was an obvious humongous effect on both legislative cycle, but also on the proposed budget and the projected budget. This meant that the January proposals basically got pushed out completely and got replaced with the governor's May revision budget, which was fundamentally a different document from the January budget and included a huge number of proposed cuts to a whole host of services that older adults rely on within the state of California. And then there was a very short time period from that May release until the budget had to be passed, where there was intense negotiation and intense pushback from the legislature on these proposed cuts. And what ultimately happened, and I'll walk through them all, is that the legislature was able to carry the day and the proposed cuts did not happen largely. So we'll walk through each, but the reason I'm talking about the proposed cuts now, even though they didn't happen, is because we want to warn people, and I will say this again at the end, that these things may reoccur, that this may be sort of a cycle that we see repeat itself in January 2021 when the governor has to put out his next budget. So with all that background said, let's go through the actual program changes. So first, the governor proposed eliminations and reductions within home and community-based services programs. Specifically, he proposed eliminating the CBAS and the MSSP program. So CBAS stands for Community-Based Adult Services Program, which is a congregate program that serves a large number of California counties, and there are over 200 centers. And the MSSP program is the Multi-Purpose Senior Services Program. And that is a home-based program that does sort of intensive case management and a lot of other things, and is also in about 44 counties throughout the state. Both those programs have been, around for 40 years. They were both proposed for elimination. And then additionally, the In-Home Supportive Services Program, the IHSS program, was proposed for a reduction of 7% across the board hours cut. And that was sort of bringing back a cut that had happened about 5 years ago that had been backfilled every year since then, but the governor basically proposed allowing the cut, which is in statute, to go forward again. So those were the proposals, but the final budget actually rejected all three of those cuts. What this means is that CBAS was preserved for 36,000 recipients, and there was no requirement for federal funding. So one other thing that was very much interwoven through the governor's proposed budget was that some of these cuts could be dependent on federal action, so that there would be a so-called trigger. This federal trigger was taken out, as when Kevin talks a little later again, you'll see why it's a big relief that that happened, given that the federal government, the Congress, and President have not been able to come to a compromise and find a solution on a next stimulus package. So CBAS is preserved for 36,000 enrollees. MSSP is preserved for those 10,000 recipients. And there was full funding for IHSS hours. So no cuts, no across the board cuts to IHSS, and that will be funded for all 630,000 people in IHSS. Next, there was a significant proposal to reduce the Medi-Cal program in several places, and this came in the form of both eligibility reductions and benefit reductions. There were a large number of them, so as I go through what the actual final budget did, I'll walk through each of these cuts as opposed to giving you them all up front. So in the final budget, we were able to keep funding for the expansion of Medi-Cal, the aged and disabled income limit, to 138% of poverty. In the governor's proposal, he had proposed eliminating this expansion altogether, which just passed in the last budget cycle of 2019-20. It has not yet been implemented. Originally, the state had planned to implement it August 1st of 2020, partially because of the pandemic and partially because of the uncertainty around whether the budget would fund it or not. That expansion has now been postponed to December 1st, 2020. And we still need to make sure that the Department of Healthcare Services goes forward with it, because there's nothing absolutely requiring that date other than that's what they've announced they're doing, but they had earlier announced August 1st. So that's a place where you have to watch things. Next, there was a proposal to also eliminate a fix that had happened in last year's budget, which I've referred to here as AB 1088. That was the name of the bill. Basically what the bill did, and some of you may be familiar with this problem, is it fixed sort of an administrative problem that can happen for Medi-Cal recipients who flip from share of cost Medi-Cal to free Medi-Cal back to share of cost. And what changes for them is not their actual income, but the amount of money that is disregarded because of their Part B Medicare premium. So what happens is basically when they are paying themselves out of pocket for their Part B premium, the state counts it as a deduction and that lowers their income. The second the state starts what they call buying in that amount for them, it's no longer a deduction, their income on paper rises, and now they go on to share of cost Medi-Cal. So this is sort of affecting a number of older adults and people with disabilities on this program. Luckily, AB 1088 fixed that, and this yo-yoing was supposed to stop. The governor proposed cutting this. Luckily, it was preserved in the budget, and so we now expect that to be implemented at the same time as the A&D expansion to 138 on December 1st, 2020. Additionally, there were some other proposals. First, there was around the Medi-Cal estate recovery rule. So a number of years ago in 2017, there had been a positive development in the Medi-Cal estate recovery rules, where basically the limiting of them meant that less people were subject to those rules. And that's where the state can basically ask for repayment from a person's estate after they've used Medi-Cal services and then passed away. We want the limited rule to remain. That's a positive development. The governor's proposal proposed expanding the estate recovery rule again to basically include more people to make the state able to collect from more people's estates. But luckily, we were able to preserve the limited Medi-Cal estate recovery rule in the final budget. Next, there was a proposal to cut a huge number of Medi-Cal optional benefits. And it is a huge laundry list, but it's things like audiology, speech therapy, physical therapy, different other services that may not feel very optional because they're a part and parcel of what people need to stay healthy and well, but they are technically optional in that the federal government does not require the state to offer them as part of the Medi-Cal benefits package. So this would have been a huge reduction in the number of services people would have been entitled to through Medi-Cal. And luckily, again, we were able to have the full preservation of those Medi-Cal optional benefits. And lastly, again, these are something you may be familiar with from previous cycles. During the last Great Recession, adult dental benefits in Medi-Cal were completely eliminated. We were able to get a partial restoration of those benefits back in 2014, and then a full restoration of those benefits in 2018. The governor's proposal suggested going back to that partial restoration from 2014, and that would have cut out some very necessary needed services. For example, partial dentures were something that were unavailable under the limited restoration, but were available under the full restoration. And so you ended up with perverse and honestly horrifying results where people were having good teeth pulled so they could get full dentures instead of being allowed to get the partial dentures they actually need. Luckily, we were able to preserve full adult dental benefits. And then lastly, I just want to touch on two things that did not actually happen in this budget, but one I think is a bigger deal than the other. First, there had been a January proposal to expand Medi-Cal benefits to undocumented seniors 65 and older. That would have been a really welcome increase in the number of people who could have been eligible for Medi-Cal. And this is a population that largely has no other route to medical insurance. So this would have been helping about 30,000 undocumented seniors. Given the state of the budget, there was a concern about obligating the state to pick up coverage for so many additional people, and they decided not to go forward with that expansion. Just to be clear, that had only been at the proposal stage. It had never been passed into law previously. And the other thing that happened was there was a delay in the implementation of the CalAIM proposal. And this initiative is seeking to expand sort of how the state handles a bunch of different pieces of its Medi-Cal program and sort of make things hopefully work better, more seamlessly, expand, not coverage, but expand sort of services in certain places. That proposal did cost money though, and the state decided to delay its implementation and instead seek an extension of their current 1115 waiver so that most of the programs and services that you see now should continue on seamlessly. But that was a concern the state had, was whether or not they were going to continue with CalAIM. In theory, they will continue with it, but it's just been delayed for now. And so what does this all mean? Well, honestly, this is an amazing amount of wins. Most of us felt pretty sure that we were going to be taking hits in the budget and that there were going to be programs eliminated or services majorly reduced. And so we should all be happy that that did not happen and that 2021 budget preserves a lot of programs and services for older adults. Honestly, there was amazing advocacy from our community, and we need to celebrate that and continue that. We really see this as preservation of California's HCBS infrastructure during COVID, which has really increased the obvious need for home and community-based services and the need to get people out of institutions when possible to stop the spread and to keep people safe and healthy. But we do have more work to do. So as I mentioned earlier, we think that we could have additional problems with implementation of the Medi-Cal aged and disabled expansion to 138% of poverty and the fix on AB 1088. And we still have to work to expand Medi-Cal for undocumented seniors. So next, let's move on to the California budget and what happened in the SSI program, SSP program, and other aging programs. So first, on the economic security side, for those of you familiar with the Supplemental Security Income Program, you know that there's a California state supplement portion, which is the SSP portion. The state is required to put in a certain amount of money to match what the federal government is giving. California, over the last several years and during the last recession, had cut its grant amount to the basic minimum and only recently had started to include a little cost of living increase and to start to bump things up. This year, there is supposed to be a federal cost of living increase to give people what amounted to basically a few extra dollars a month, but it was definitely extra money, and I'm sure it was very needed by everyone on SSI. The governor's original proposal was actually to capture that money for the state and to use it for other purposes. So this would have had the real world effect of actually reducing people's grant amount so that what they should have gotten as a federal increase, they basically were going to be denied. Luckily, the final budget included the COLA for the SSP grant, and so people should have seen an actual bump in their monthly allocations every month. Next, there was a proposal to cut several of our aging programs that are funded through a variety of different sources, but basically what they amounted to was a lot less money flowing into older adult programs and a real reduction in what services could be offered. So there were proposed cuts in funding to the caregiver resource centers, to the senior nutrition programs, to the long-term care ombudsman, and to the aging and disability resource centers, ADRCs. Luckily, again, through a lot of advocacy and pushing back, full funding was preserved for all of those programs. And so we're really thankful that they can still continue to do the good work they're doing for the variety of people who need those programs and for the variety of different issues they touch on. So caregiver resources, obviously helping those often unpaid family and friend caregivers, senior nutrition, making sure people have healthy meals and don't go hungry. The long-term care ombudsman is providing oversight and a place for a real link for those living in long-term care facilities to make sure that they don't suffer from abuse or neglect and the facilities are operating properly. And then the aging and disability resource centers are really hubs that are providing resources and connections for older adults and people with disabilities. So full funding preserved on all those programs. So again, what does that all mean? It means, again, sort of shockingly, we won. And we were able to preserve a lot of very necessary programs. Again, this was not did not happen by accident. We had amazing advocacy from the community. And as someone who's been working in the older adult space now for a number of years, the amount of people calling into hearings, writing letters, talking on social media about this, and really pushing the governor and the state to do the right thing was really inspiring. Again, we still have more work to do. One of the things I mentioned was that the SSI, SSP grants were cut during the Great Recession by around $80 a month. And we have never restored those cuts. And we think that was about $1 billion in savings every year to the state. And so while the state was reaping the benefit of those cuts, low-income Californians were basically bearing that cut on their backs, and they weren't able to buy the things they needed, to buy the food, the medicine, pay their rent. So we still need to see those SSI, SSP cuts restored for our lowest income seniors. And finally, I want to leave with a little bit of a warning. We are not out of the woods. So the proposed budget cuts that happened may seem familiar to some of you, and that is because they came out of a very similar round of cuts that happened during the Great Recession. As you can tell, I had to mention that several times, and that's because it felt like a very similar playbook was pulled out, and these cuts kind of came at the same, out of the same sort of bucket of cuts that actually went through during the Great Recession, but we were able to stop this time. So we really need to remember that more budget problems loom for us, and that there's another budget to be proposed in just a few months. Next, we are going to need more revenue. We cannot cut our way out of the type of budget problems that are coming up upon us. So we need revenue from the feds, and we need more revenue from the states. And Kevin will talk a little bit about the Fed piece, but on the state side, there have been some bills pushed forward to do some revenue generation. Nothing has sort of happened yet, but I think that's going to be a big focus at the beginning of next year, and maybe even at the end of this year as we start to gear up for what has to come next. And then we really need to stay vigilant, because these cuts can come back. I think a lot of us think they will come back, and there's a real need to stand up for older adults and people with disabilities. And, you know, that's always true, but it's never more true than during COVID, when we're seeing such high death rates, such high infection rates. We're seeing how necessary these programs are to preserving people's health and safety and well-being, and honestly to keeping people alive. So if there were ever a wrong time for cuts to the programs that keep older adults safe, it's now. And so we need to work to stay vigilant so those cuts do not happen, and that the state does not balance its budget on the backs of seniors. So thank you for listening. That's my portion of the presentation, and I'm now going to turn it back to Kevin for the other pieces.
Thank you, Claire, for that update on everything happening in California. As you'll see, as we transition now to talking about the federal landscape, that some of what Claire mentioned a couple times, and then at the end there, really critical to be watching what's happening at the federal level to the extent that it's going to impact revenue options and revenue impact for California's budget. But let's get into some of that now. So I'm going to be covering federal legislation now and opportunities for some advocacy and action here. The first half of the year was a year which saw a lot of federal legislative and administrative action tied to, of course, the COVID crisis. So the last couple of years, it's been difficult to see any positive legislation come out of Congress, but COVID created an environment where both parties were very motivated and all branches of government were very motivated to take action to address some of the harm, both the public health harm and the related economic impact. So there was a lot of legislation early in the year. And then there was also, of course, a lot of administrative activity to deal with the COVID crisis and the impact of it. I'm not going to cover everything here today because that would take several sessions on its own, but I wanted to highlight a couple things. That there was legislation early in the year, 2 pieces of legislation that were particularly responsive to the COVID crisis. There was the CARES Act and the Families First Protection Act. Collectively, these pieces of legislation did a lot of things that hopefully you all know about and have read about at this point. They included the action to expand and extend unemployment insurance, the stimulus payments that were delivered to American families, the PPP program, which was loans for small businesses that were able to be turned into grants. There was also an array of types of funding for various healthcare services, for acquisition of PPE. There was creation and expansion of some leave programs and leave benefits that employees and employers could take advantage of. So lots of different things in this legislation. For the purposes of older adults and access to healthcare programs and economic security programs, I want to highlight a couple of things that happened, some in connection with that legislation and some independently on the administrative side. Again, just kind of looking at this big picture. On the administrative side, the Centers for Medicare and Medicaid Services created a lot of new flexibility for states in their Medicaid programs so that they could use funding in certain ways, availability of some more funding in certain spots, some redesign of program rules that, for example, have created many more opportunities for people to receive services through telehealth, lots of administrative guidance and rulemaking around situation in nursing facilities. So a lot of action there. Also some requirements about what states must do, like while we're in this period of still a crisis and emergency, states, for example, can't terminate older adults and people with disabilities from their Medicaid coverage. So there's a whole kind of collection of activities there that we're happy to go into more in depth in the Q&A or in another session sometime. Another positive thing that happened was the stimulus payments that were $1,200 provided to Americans with incomes below a certain amount were also available to older adults and people with disabilities that fell into the income eligibility standards there. There was some question about whether those payments would be delivered automatically to people with Social Security benefits or whether those people would need to file a tax return or some other form to qualify for the payments. And the good news was that those payments were automatically delivered to people receiving Social Security as well as people on SSI for the most part. Were able just to receive those stimulus payments automatically without having to take action themselves. So that was very positive. But the legislation that happened earlier in the year is not enough to deal with what is clearly ongoing and significant crisis. A lot of work was not finished in the bills that did pass through the Congress and were signed in the White House. So a lot is still needed, and we're working with partners in DC, other in the aging space, the disability advocacy community, healthcare advocates, civil rights advocates, nutrition support advocates on a number of issues. Some of them are included here. So some of the things that are still being pushed for in hopeful future Action out of DC is to make racial equity an affirmative goal of our country's response to this crisis. The data has made clear that Black and Indigenous, Latinx communities are particularly feeling the impact of COVID. Higher rates of infection, higher rates of death, higher rates of complication due to contracting COVID. And so we know that that's because of long-time inequities in our healthcare system and our economic system that have created disparities in health conditions and access to care. And so those issues need to be addressed as we create future legislation to address the crisis. We're asking that the Centers for Disease Control collect comprehensive and intersectional data so that we understand what is happening with the COVID crisis, how it's impacting communities differently. We want data that includes age and gender and race and ethnicity and LGBTQ status and other data so that we can really see just the impact this crisis is having and to inform appropriate and targeted response. We're looking, this is a big one, especially to what Claire was just talking about, is we're looking for additional support for Medicaid programs. States are having to spend a lot of money to address the COVID crisis. At the same time, they're seeing state revenues dip because of the economic impact of the crisis, and that's going to be brutal for state Medicaid programs, including, like Claire outlined, for California. So we need the federal government to step up and to help provide additional federal match to Medicaid programs so that we don't end up seeing states dramatically cut access to healthcare while in the middle of a public health crisis. Within that, we're working with other aging and disability advocates for increased financial support for home and community-based services in particular. I'll admit that this has been a long-term goal of our groups to see more funding flow to home and community-based services, and that the COVID crisis has confirmed just how critical that kind of support is. We're seeing predominantly, a huge number of the deaths that are occurring in California and elsewhere are occurring in nursing facilities, and to a lesser degree, but also to a significant degree, in other congregate settings. So we need more funding at this point to support programs that keep people at home and in the community and help transition them out of those congregate settings where currently they're at the greatest risk of contracting and potentially dying from COVID. So we're making this a central demand as well. We need continued stimulus payments and expanded access to those stimulus payments targeted again to low-income people and ensuring that older adults and people with disabilities are qualifying for those payments. We need further federal action on housing issues and on homelessness prevention, particularly around threats to eviction. Just at the beginning of September here, the CDC did take some action to impose a national moratorium on eviction, and we're still working to understand what the implications of that are. California has also taken, here at the beginning of September, some strong state-based action as well, but that needs to continue. We need more federal support and federal intervention there. Also for access to SNAP benefits, Supplemental Nutrition Assistance Program, or food stamp. We're seeing a huge surge across the country and in California a need for these benefits. So we need, again, that federal support there. And then also at the federal level, we've been working for expanded funding for senior legal services. Older adults are so particularly impacted by this COVID crisis. They're not the only group impacted, but they are at higher risk. And so we need more support for them, including legal services to help them navigate all of the complexities that are accompanying their experience with COVID. Now, will any of these things happen? We don't know. Again, I think it's here important to remind you that we are recording on September 2nd. So by the time that we're with you on September 22nd, we may have more to share in our Q&A. What's happened so far is that a couple months ago, the House did pass additional legislation, the HEROES Act. It included many of the items that I shared on the slide prior to this, and the Senate has not acted on that bill. In the summer, There was some attempts to reach a deal between the Senate and the House and the White House, and those negotiations never really got off the ground. The White House and Republicans in the Senate did not seem interested in doing anything at all at several of the items that were included in the HEROES Act, including the support for states and Medicaid program that Claire talked about as being so essential to California's future budget revenue projections. So as it sits now, there's a stalemate. There's not any new action in Congress. The president has offered, sometimes suggested, at other times actually taken action on executive orders that he's represented to be taking action on taxes, on eviction moratoriums, but those executive orders don't seem tied to any actual real life impact for people. And again, we can get into some of that in the Q&A if there's interest there. So at this point, we're not even aware that there's active negotiations happening, at least not that are being reported in the press, but that all can change. And hopefully that there is some action to provide relief on the critical issues covered in the slide before, and as Claire said, you know, the impact for California's budget is significant. So we're going to change gears from the legislative, both you know, the budgets and legislative issues that Claire covered, as well as the issues at the federal level. We're going to talk about the California Master Plan for Aging. So a really important policy issue that has been something that many of us have been working on over the last year. We're going to give a little background on that and an update on where things stand today. So the Master Plan for Aging was an initiative of Governor Newsom. A little more than a year ago, he released an executive order calling for the state to create this Master Plan for Aging. It was a promise he made during his campaign, and one that he took action on you know, shortly after taking office. The master plan, part of the master planning process was to engage stakeholders in developing recommendations to inform this master plan. And an essential component of doing so is creating a stakeholder advisory committee of about 30 to 35 members that have expertise in working with older adults and people with disabilities to inform this process. I was fortunate to be selected and have been actively working in that committee. That committee worked with the California Department of Aging to develop 4 major goals for the master plan. In addition to those 4, each of those 4 major goals has a work group that is working on those goals. And then the group also identified equity as another key consideration and developed an equity work group as well. I'm going to go into a minute what all these different goals are, et cetera. So the work of these groups started in September of 2019, continued in the fall, in the winter. There was lots of meetings, reports being written, lots of activity. Then when COVID really hit us in March, the work of the committee went on hiatus for several months. We came back into work in May. At that time, one of the major goals of this project is around long-term services and supports and providing recommendations for how to move the state forward there. And in May, the LTSS subcommittee delivered a report on their recommendations to the governor. At that time, there was also the equity work group created an equity tool to help inform the development of all the recommendations in the master plan to ensure that equity is at the center of that. The reports on goals 2, 3, and 4 are due October 1st. And the committee is working a lot throughout the month of September to finalize those reports, and the stakeholder work will be done as of October 1st. The work of the stakeholder groups will then go to the administration. Those reports will go to the governor, and more specifically, the California Department of Health and Human Services, and the Secretary of Health and Human Services, Dr. Mark Galley, is convening other cabinet level directors of departments and secretaries to create a master plan. And that final master plan for aging will come from the governor in December of 2020. So there's a lot of stakeholder work that's been happening, that's happening now. It's going to all wrap up, and then it'll be passed to the administration, and the administration will actually write and produce and present a master plan based on all of those recommendations received. I mentioned that there's 4 main goals. The first is long-term services and supports, is goal 1. The second is livable communities and purpose. The third is health and well-being. And the fourth is economic security and safety. So there's these 4 main goals of the plan. In addition to the goals, there are cross-cutting priorities or principles that are relevant to all of those goals. So the first is ageism and equity, that the plan explicitly take on the issue and problem of ageism in our state and in our country and our culture. And that the plan is informed by principles around equity. And there's recommendations being developed, including definitions of what's meant by equity. That what that has meant is a focus on racial and ethnically diverse communities and how they experience aging, and what type of services and interventions we need to support that community. Also looking at issues for women as they age, for the LGBTQ community, for immigrant older adults, for unique issues for people with disabilities, and other areas where we can identify inequities and differences in how we age, and so that the plan is responsive to that. Another cross-cutting priority is research and data. There's been a research subcommittee that's developing a data dashboard for measuring progress towards the goals in the master plan. And then also wanting to build dementia-friendly cities, dementia-friendly systems, so that all of the work and the policies that are implemented in the master plan are thinking about how we serve and support individuals with dementia and their families and caregivers. As I said, that the governor is going to produce this master plan in December. And our community of advocates, it's important that we don't just let this master plan sit on a shelf somewhere. We're in September. We've been working on these massive reports full of recommendations, and we're dealing with hundreds of pages of great ideas, and we don't want that work to be printed and shelved and never looked at again. We are going to continue to need to really keep up the advocacy, to be really clear about what our priorities are, where we want the state to take action today, as well as where we want to be in 2 years and 5 years and 10 years as a state. This is meant to be a tool that helps us over a long period of time. That's going to be critical because of the budget situation that Claire outlined in her presentation. We're in a recession. We're going to be finding out just how deep that will go and how dramatic the impact will be in California. So there's going to be competing priorities. There's going to be a reluctance to spend new money. And there's going to be even a challenge about holding on to the resources that we have. So it's going to be critical for continued vociferous advocacy to make sure that the needs of low-income older adults are centered in the work that the state takes on. The issues of race and other inequities are centered in the work that the state implements here, and involvement from all of you that have experience serving older adults, that care about this, that know how systems work, know what's not working in systems. This master planning process is really the beginning of advocacy opportunity. And even as the governor finalizes his plan, that's certainly not an end, it's just a new and I think a more powerful vehicle for us to engage in advocacy for our clients. So that was all that we had prepared for today. We're really, I think we covered a lot, and we're excited to have the opportunity to now engage in some discussion with all of you about that, to answer questions you have, to hear what's on your mind, and to be in dialogue about that. So we look forward to that discussion.
Thank you, Claire and Kevin, for those amazing presentations. You're both so skilled at making policy digestible. I'm impressed with everything you're able to present in such a short time. I really appreciate that Justice and Aging always includes messaging about the agency's commitment to equity, diversity, and inclusion. Our audience has many questions which we'll hope to get answered in our Q&A. We have about 20 minutes set aside for anything, and anything we don't get answered today, we will follow up with guests after the presentation. As a reminder, if you have any questions, please submit them into the Q&A icon at the bottom of your screen. And in order to see all of us on screen, click on Speaker View in the top right corner of your screen. Let's invite Claire and Kevin back on. Hello, Claire and Kevin.
Hi, Jenny.
Let's get to our first question. As you mentioned, the presentation was recorded on September 2nd. Are there any policy updates or changes that you want us to know about today that have happened since the recording? I think you're both muted. Claire and Kevin, can you unmute yourselves?
Yes.
Okay.
Are you hearing me now?
I hear Claire.
Okay.
Are you with us?
Kevin, you're
Kevin,
still
on mute.
How's that? Is that better?
Yes, we've got you both
Great.
with us now. So any updates
Sorry
you want to
about that.
make?
Yeah, so thanks so much, Jenny, for leading us through the Q&A today. And the main policy update is on the Master Plan for Aging. The Master Plan for Aging Stakeholder Advisory Committee had their last meeting last week, and the group submitted all of the recommendations formally go into the administration today. And at the meeting last week, the Stakeholder Advisory Committee presented an executive summary of the main priorities from all of the volumes of recommendations that were created. The main priorities, there were two overarching principles, one around equity, that the Master Plan for Aging, as the governor creates his plan, it needs to keep equity at the center as well as during implementation. The second overarching principle was around leadership. The group was calling for high-level leadership across state agencies that would be focused on aging and inclusive of issues for people with disabilities as well. And then the three priority issues that the group identified were rebuilding, reforming, and financing our long-term services and support system, creating affordable housing options for all Californians, including older Californians, and third, ending poverty and health disparities for people as they age. So that's all now been submitted, and the administration now is going to be doing work at the cabinet level, and the governor will release his master plan for aging in December.
And Claire, did you want to add anything to that? No, okay. And then I know that you wanted to talk about the impact of Justice Ginsburg's death and how her replacement on the Supreme Court will affect healthcare issues for older adults and others. Could you talk about that?
Yeah, I mean, that's the other significant update, is that sadly on Friday, Justice Ginsburg passed, which is a tremendous loss for the legal community. Justice Ginsburg was someone who really was just a pioneer in fighting for civil rights of people, particularly women, and worked on many important cases for folks that work on aging and disability issues. She argued in front of the Supreme Court a landmark case that created an entitlement to widowers' benefits in the Social Security program. She authored the majority opinion in the Olmstead case, and then had many cases where she was an influential voice on issues of a variety of civil rights, including related to gender, LGBTQ, race, issues of race and civil rights, so many. So her loss has a big impact. particularly looking at her replacement on the court, the main issue to consider is healthcare. It's very likely now that if a new justice is appointed to the court before November, then that justice would hear the Affordable Care Act case. The Affordable Care Act is going back in front of the Supreme Court to be considered whether the whole law is constitutional. And it's very likely that a justice that was appointed by this president and this Congress or this Senate, approved by the Senate, would side to strike down the Affordable Care Act. If the Affordable Care Act is struck down, that will create tremendous chaos in our entire healthcare system. There's estimates that 20 million people could lose access to coverage, many of those in California. California's state budget would be dealt just a devastating blow because of the connection between the state budget and the state's Medicaid program. And older adults would lose access to all kinds of services and programs that were created by the Affordable Care Act. Medicare costs would go up, prescription drug costs would go up, certain benefits that have been created around expanded access to home and community-based services, new programs in the Medicare program, all types of innovation in payment systems in Medicare and Medicaid could all be thrown out by this court. And that all became much more likely with Justice Ginsburg no longer on the court and a replacement chosen by President Trump and confirmed by the Senate. So that now is probably the biggest policy issue at play, is what happens with the Affordable Care Act and how that is now changed by the changing composition of the court.
And Kevin, I just wanted to also add that for context, in California, about 13.5 million Californians are on the Medi-Cal program. About a third of those are under the expansion that was provided by the Affordable Care Act. And so you can see a lot of older adults in the 50 to 65 range likely lose insurance under Medi-Cal if the Affordable Care Act is struck down. And then put on top of that, there's another million plus people in covered California on the exchange. And they would also not have an obvious route to affordable health care anymore as well. So it is a huge number of Californians who would make up that 20 million in loss of insurance if the ACA is struck down.
Thank you both for that very significant update. We've got some audience questions. The first one I'll start with is, do you think community-based adult services is still at risk for next fiscal year?
Yeah, thank you for that question. I think it definitely is. You know, this has been a very challenging environment, partially because, as Kevin explained, the Master Plan for Aging has been seen as a largely positive, forward-looking piece of work and a real commitment by the administration to work on older adult issues, which I think we're all very thankful for. And as people who work in this space, we know that's not often the time and energy isn't necessarily put into this space. So that's all been very positive. But at the same time, the budget was bad this year. It is going to be worse next year when the actual heavy fiscal effects are started to really be felt. And I think everything that was on the table could be on the table again, and possibly worse. And this is anecdotal, but I was recently in a meeting where somebody said, you know, this is all secondhand, but they heard someone else say, if you think the Great Recession cuts were bad and you think the deficits caused by the Great Recession were bad, you haven't seen anything yet. So, and those were in the tens of billions of dollars. So yes, CBAS I think is still very possible for elimination. Same with MSSP, potential for big cuts in IHSS and other health programs.
Thank you. Will the Medicaid A&D 138% increase for eligibility change be confirmed to community providers in December?
Yeah, that's a good question. I don't know how much outreach the department's going to do to community providers. They are supposed to be sending a letter to recipients to inform them that they are going to have their Medi-Cal reevaluated. The state has put out an all county welfare directors letter. They actually did that early in the year. It is ACWDL 20-02. And that goes through all the technical things the counties need to do in order to update the income level for individuals. I'm not sure people who are providers will see more than that. They might have had clients who were formerly on share of cost, now moved to free, which I think is going to be the most obvious change for some of your participants. But what will hopefully happen is we will see the rolls increase when the income limit goes up, because new people who apply will be eligible for free and will stay on, where before they may have been told you can apply, but you'll have a share of cost, and they might have been dissuaded from actually moving forward with an application.
Thank you. What's the time, what is the time period for Medi-Cal recovery on an estate?
Yeah, we can tell that the questions came in order, right? Medi-Cal state recovery is for individuals 55 and older, and I'm going to read a little bit. And for those who died on or after January 1st, 2017, you basically had to own assets when you died, and then not all costs are recoverable. That's what the limited rule really was very important for, was that now it is mostly for institutional long-term care, home and community-based services, including Medi-Cal premiums paid to your managed care. Those are recoverable costs, but other healthcare costs incurred are not. The Department of Healthcare Services has a good web page which goes through these Medi-Cal state recovery rules pretty simply, and also CANR, which stands for California Advocates for Nursing Home Reform, canr.org, also has some good fact sheets on all of this. So the rule changes were positive, and we don't want them to go back to the old rules.
We refer to CANR all the time. We love them too. How many undocumented seniors in California would have been covered?
We think it's about 30,000, so kind of commiserate with the number of seniors who should gain access through the expansion of Medi-Cal to 138% of poverty.
Thank you. Does the 2020 census have any bearing on funding that impacts our clients in Alameda County? We're encountering a lot of resistance from folks who don't trust the government, so don't want to complete their census either.
Yes, the census has a tremendous impact on communities across the country. The census data is used around decisions and formulas for all kinds of federal funding that flows just based on how many people live in one area or another. So it's incredibly important that we get as many people as possible, that we get everyone to participate in the count. So if your organization is in a place to help spread that message and help assist people in being contacted, then please do so.
Thank you. Is Governor Newsom still mandating that every California citizen have healthcare or insurance by the end of 2020, or they will be fined?
My understanding, just, I'm not an expert on the individual mandate, but California last year did reinstate the individual mandate to help pay for health insurance. Yes, that is still in effect. It went into effect January 1st. I will put quickly into the Q&A and answer. There was a good webpage I found through the FDB that explained it. So I'll put that in the chat box or in the Q&A box, and it comes with a calculator as well to anticipate the penalty if you don't buy health insurance or don't sign up for health insurance. And I'll do one plug. California has not seen a huge jump in Medi-Cal enrollment, even though so many people are unemployed. And so if you have clients who have lost health insurance through an employer, they can go onto the exchange and apply for either, the exchange will figure out if they're eligible on the Medi-Cal side or if they're eligible for coverage through Covered California. So I really encourage, if you have a client who's lost health insurance, to sign up now. Because it's available. And losing your job, losing your health insurance are all reasons that they would allow you to sign up late anyway, but Medi-Cal is always available.
Excellent.
Just one thing to add on that, just around the framing of the question that came in. This is not a mandate from Governor Newsom. This is a law that California legislature passed and the governor signed to restore the requirement that people purchase insurance in California. It's one of many ways that California responded to federal changes in the Affordable Care Act, either from Congress or the courts, and California reacted in ways that really helped blunt the impact of those changes and kept the Affordable Care Act very strong in the way that it operates in California. So California has really been a leading state in leveraging the Affordable Care Act to make healthcare operate in terms of covering people and keeping our healthcare system running well in California. So I think that's important to understand, and to also understand that if the entire Affordable Care Act is struck down as unconstitutional, California is going to have fewer levers to pull to stabilize our healthcare system. So far California has been very active in trying to be responsive, but there's if the court strikes it down, then California's options will be more limited. That's why it's so critical that that not happen.
Thank you. I'm going to actually add right there that if that person who has lost their insurance is 65 or has been on long-term disability for 2 years, they should call our office at LAS to talk to our HICAP program, because the person may qualify for Medicare, and it's important for them to make sure that they're following any rules around that. So plug for the HICAP program, please give us a call if the person is an older adult. So let's see. Someone wanted to know, how can I submit ideas for the Master Plan on Aging planning groups? Is it too late? That's my addition.
It's now officially too late. Today was the day that all that work, that the final versions of all those recommendations are submitted. I think that California Department of Aging is still operating a website called engageca.gov, I think it is, or maybe it's a .org. And I think that they still have an open portal there where you can still offer recommendations. But the formal process is now complete.
Thank you. Could you repeat the 4 main priorities of the master plan?
Yeah, so I'm sorry that I was a little confusing. So there's, it's a little confusing. The master plan for aging has a stakeholder advisory committee that created 4 main goals, and those goals relate to long-term care, health and wellness, livable communities, and then economic security and safety. So those were the 4 big goals. The group did a lot of work, and then throughout of that work identified 3 priority areas that they want the governor to be sure to take action on. Those 3 priority areas ended up being around long-term care, housing, and poverty and health disparities together. That is all just recommendations from the stakeholder advisory group. What the governor eventually includes in his master plan, we don't know yet.
Thank you. Someone said there is such a synergy and benefit when you get older and younger generations together. Is there anything proposed along the lines of bringing together, integrating different generations?
I think that's maybe a question about the master plan. I think, Claire, maybe we could talk about if there's some policy stuff happening like in the next legislative session. On the master plan side, that is something that the master planning groups talked about a lot. One element of that was talking really about aging, taking a lifespan approach, realizing that aging is something that we're all doing every day. It's not just something that you do when you're older. And so really thinking about aging as this continuum and trying to create programs that benefit people throughout their life. I think there are some specific recommendations from the various work groups that might include, cross-generational programming. A common idea that is talked about is housing that includes people from multiple generations, or co-locating childcare services with adult day health care. Ideas like that are in the mix, and then the broader theme of trying to think of it as a lifespan approach, not just something that we start attending to once people cross a certain age threshold.
Thank you. Do you think, that's a tough one, guys, do you think there should be a wealth tax on billionaires to protect the safety net for seniors?
So a couple things. I mean, if you're asking me, Claire Ramsey person, yes. Justice and Aging right now doesn't have a position on any of the actual proposals. There are a couple, well, I should say there were, because the legislative session has now ended. There were a couple of wealth tax proposals that didn't end up sort of going anywhere this year. There could still be a special session in fall, so something could come up. You know, wealth tax may be an answer. California obviously is both a wealthy state and a poor state, and we don't always acknowledge that very well. We don't always think a lot about how those two interplay with each other. Whether it's a wealth tax or something else, California needs to think about revenue. And so that's what I would really drive home for people. That is going to partially need to come from the federal government. California cannot print its own money. So, you know, big spending often needs to come from the federal government, but I think California needs to look within itself as well and say, how do we raise money effectively, and how do we fund services for older adults and other social services, and how do we create a more equitable California so that we don't have these huge disparities between super ultra very rich people and extremely, extremely poor people. And so I think that's going to be the work. You know, Kevin mentioned implementation of the master plan, and that's not the only vehicle for this, but I just think we have to be using all forms we have to be discussing these types of topics as we move forward to be good advocates in this area.
Yeah, and I'll just add that the revenue, each new day brings new reasons why we need the additional revenue. So we knew we were going to need more revenue 2 years ago. If you just look at the changing aging demographic and the growing numbers of people that are aging and people that are aging with disabilities, and the need to provide care for those members of our families. And then the pandemic created additional need within many communities, including older adults and people with disabilities. And then the economic impact of the pandemic created likely revenue shortfalls for California. So, you know, the needs are growing and our revenue has to grow to match. And these are, as Claire laid out, you know, these are issues that are very linked to the economic inequality that we have in the state. Even how people are experiencing the economic impact of the pandemic, you know, is totally divergent. With some people doing well economically, even better than they did before the pandemic, and others doing much worse. And so we need to find a way to build community together and to find revenue where it is. And much of the revenue now is with a shrinking number of Californians that are the wealthiest. But the needs are rising across all of our communities.
And I'll end on this one. Could California do more on maltreatment and exploitation of the seniors moving forward?
Yeah, absolutely. So in the master plan for aging, one of the reports from goal 4 includes recommendations on elder abuse and elder justice that include some recommendations specifically about abuse, neglect, mistreatment. Some of the ideas there include, you know, modeling the work at the federal level. At the federal level, there was created a Elder Justice Council, which pulls across agencies from across the federal government to work together to address elder abuse and maltreatment. So we're calling for something similar like that in California. There's a whole array of policy options there for California, so we're hoping that more attention is put there. We also talked in that section, that work group identified legal services as a key component of addressing elder abuse and called for more funding for direct legal services for older adults as well.
All right, I know I said it was going to be the last one, but we're sneaking in one more. Are there things that California can learn from other states when it comes to better healthcare and housing for seniors?
You want that one, Claire?
You know, I guess what I'll say is this is one challenge of California. There are things that certainly California can learn from other states. Other states have had, you know, successful programs for home and community-based services and some more successes around dual eligibles who are on Medicare and Medi-Cal. California tends to see itself a little bit like a unicorn because it is sort of unique and it is so large and diverse. But I think sometimes that's also an excuse. So I do think one thing we can start to think about is when we see good models in other states, we can start to adopt them. I'm not a housing expert, but, you know, for example, a lot of other states have done a lot better job housing people after they've experienced homelessness by taking a housing first policy, by really not requiring people to go through a whole lot of steps to get housing. It's like house people and then help them with whatever conditions, addictions, mental health challenges they might have. California has just really been very, very slow to get off the ground with any sort of really meaningful, large-scale housing for homelessness, and for expanding housing enough to basically serve and house the number of people who need to be housed. So I do think there are models elsewhere that are good. I think you're always going to have to think about what adaptations is California going to have to make in order to do this in a way that works for California. But I don't think that should limit us from looking at other states that have been successful and trying to use models that have been successful. Kevin, I don't know if you have anything else to add.
That makes a lot of sense. Thank you. So before we wrap up really quickly, I do also just want to say, I mentioned that someone can call our office about the HICAP program, but I quickly realized that we have a wide audience on here. So I just want to mention that there is a Medicare counseling program no matter where you are. So if you're not in Alameda County, you can find your local HICAP, or out of state, it may be called a SHIP. But if you have someone that needs help with their health insurance, please call the HICAP or SHIP in your area. And so with that, we're going to wrap it up for today's program and share a few reminders for everyone. First off, thank you, Claire and Kevin, for your insightful presentations. We'd also like to thank our top sponsors: at the Diamond level, Michael Stevens, Probate and Trust Realtor, and at the Platinum level, Campbell Green, LLP, Trust and Estate Attorneys. Claire and Kevin's presentation will be available on the LAS website within the next week. If you need CEU credits, please look out for the post-event email in your inbox in the next 24 hours. We invite you to sign up for the rest of our webinar series by visiting the LAS website and going to Events. Our next program is Recognizing, Preventing, and Addressing Financial Elder Abuse on Tuesday, September 29th at 12 p.m. For any questions or comments about today's webinar or the program as a whole, you can email us at conference@lashicap.org. And thank you again for joining us today, and we wish you a great rest of your week.